Welcome you all. Namaskar. I am Ravi Gupta. I am a CEO and founder of Elis Techno Media Private Limited, and I'm also editor-in-chief of eHealth magazine. eHealth magazine is India's first magazine on focusing on ICT-based innovations in the healthcare sector. We are a 15-year-old magazine. We have started in 2005, and we also run a eHealth portal, which collects and disseminates information and knowledge about IT in healthcare and also innovations in the healthcare segments overall. Today, we are right now in the fifth session of the day. This is the Healthcare Transformation Summit being organized by ALS Technology Media and eHealth Magazine. And this is a two-day summit, and we are discussing various aspects of healthcare innovations, including COVID-19 situation. Also, we are talking about National Digital Health Mission and other interventions in the healthcare sector. So we have an eminent panel of speakers right now, and some of the speakers are still trying to join in. There are technical issues, so they will be joining in the middle of the session. We have right now with us Professor Sarnam Singh. He is a director of All India Institute of Medical Sciences, Bhopal. Welcome, sir, and thanks for joining us here. Namaskar to you. Thank you. We have Dr. Lal. She is the director of medical education and head of Joan Medical College, Government of Mizoram. We have with us Ratan Kelkar from the government of Kerala. He's the mission director, National Health Mission. Welcome, Ratanji. Thanks for joining us. Namaskar to you. And we have with us Dr. Sanjay, who is who's representing Mylan Pharmaceutical Private Limited. He is Senior Manager Medical Affairs at Mylan. And we also have with us Naresh Asicha, who also represents Mylan Pharmaceutical. He is the Senior Vice President at Mylan. So let's start with Professor Sarman Singh. Sir, that the question about that the COVID situation is like visible to all of us. The numbers are increasing across the various states. So, how is your institution contributing in this situation of COVID-19? And how are you also looking at effective training for healthcare workers to fight against COVID-19? Sir.
Yeah, thank you, Dr. Ravi and other colleagues. Very nice to interact with speakers and the viewers on the live telecast of this webinar. As you very rightly, pointed out that Corona or the Corona epidemic has unraveled many of our strengths and weaknesses also, and therefore it is very important that we usually talk of the health management, but I am happy that you raised a very pertinent question that to become a doctor or to continue the medical education these days, this is also very, very important, that how we educate our youngsters and how to conduct examinations and practicals and how to get updated. So Government of India and UGC, Medical Council of India, Ministry of Health and ICMR, all these bodies, they are really struggling. And there are, yesterday only one case we had AIMS conducts MCH or DM courses where the admissions are done on the basis of previous feeder grade, that is called MD or MS. So the one very interesting case why I am citing it, because this directly correlates with your question. So the one person, he filed a case because he could not have the MD examination and he wanted DM exam. So he cleared the DM entrance conducted by AIMS Delhi, which conducts for all AIMS. But obviously, he did not pass the MD course because his medical college was not able to conduct the practical and the theory examination. So he went to the court, and only yesterday this court decision was made. And what his plea was that it is not my fault. During the corona time, my medical college is not conducting the examination, which should have been conducted in June. And therefore, I applied for this, and I should be allowed to start my course as soon as my examination is done by my medical college, and my admission, which I have already cleared for the DM course, should be, I should be allowed for that. The court learned counsels, they presented, and court decided that obviously his point is well taken. It is true that many of the medical colleges, they are not able to cope up with the corona epidemic, and the education is suffering, the practicals are suffering, and the many medical colleges, they are not having infrastructure. But ultimately, after listening both the counsels, the court decided that yes, it is true on the part of the candidate, but it is also equally true that many of the medical colleges, they have conducted it successfully by virtual examinations and telemedicine and other things. So therefore, AIMS contended successfully that many of the medical colleges, they have conducted the examination in June, and we have sufficient number of the eligible candidates which we can admit, and we cannot allow this admission prolonged or delayed because of one candidate. And court dismissed the plea of this candidate. So why I am saying, because this is becoming important, that many of the in big cities, people like you are helping, many eco and various, Zoom, Cisco, and uh, various platforms, they are coming up, and definitely we are inaugurating almost one or two virtual meetings almost every day. And now it has become a dictum, and rather it is a routine practice that almost all, if we have not learned yet, we must learn it, and we have to conduct all the entrance examinations, all the final examinations, even though UGC has said. But in most of the medical colleges, we are equipped to carry out our examinations, and obviously, particularly after this high court decision, we all have to gear up. So this becomes very important, and obviously, because your question was regarding the education, I will come up for the this education becomes very important, that until otherwise with the education we are equipped with the telemedicine and other things, we are going to lag behind much. And in that direction, obviously, we are very lucky because we are part of the network of the AIMS. So all AIMS, we have the network, and all AIMS have been assigned the duty to mentor their respective states. So like in Madhya Pradesh, AIMS Bhopal is mentoring all the medical colleges. So AIMS Delhi, mentors all the AIMS, and these AIMS, we mentor the entire state for the virtual clinical management, the health updates, availability of the medicines, availability of the PPEs and other things. And also, we are doing many of the clinical studies, registries, collaborative projects, vaccine development, vaccine trials. So therefore, these days, we have become, I think, more virtual, and the network is working, I think, very nicely. And those who are not in the network, they also must learn how to work in a virtual networking system, which has become very important these days. Every week, Government of India with the AIMS Delhi and ICMR, we are conducting Center for Excellence webinars. So all the updates we exchange with each other, and how we are going ahead with that. So I think right now in this section, I would stop here, and then maybe I can take up other questions accordingly.
Sure, sure. May I request Dr. Ratan Kelkar to join in the session, please? I can see him is here, but his camera is off. Uh, let me move to Dr. Divan, who has just joined. Welcome, Dr. Divan. Thanks for joining in.
Good evening, Ji.
I think you are at hospital right now.
Yeah,
Is it?
I'm joining from the hospital.
Okay. Thanks for taking out time for us. We wanted to ask you about the what are the critical steps which your department and your organization has taken in these situations of the COVID-19 to reduce the spread and contain the situation, Dr. Divanji?
Well, it's to start with, the COVID-19 came a surprise for the whole nation, being a pandemic. We had to activate the complete health system, whether it is a preventive, curative, or promotive side of the health. To start with, because we were not aware that the travelers who are coming, they are so potent that they can spread the infection to the whole of the country. So, although the IDSP teams were taken into confidence, but too late. By that time, they have already spread in various parts of the country, so well in Chandigarh. At present, the scenario is, global scenario is well known to all of us. The challenges which we had to face in the beginning, that we did not have adequate number of PPEs, which we managed so that the security and safety of the health personnel is far more important, as it was causing a lot of scare and fear among the medical and paramedical staff. In a short span, we had to organize. We started with the trainings of medical and paramedical. We gave them the protocols of the PPEs, and I am thankful to Government of India, who had been very, very proactive in this case, because a lot of VCs were done, and the ministry was kind enough to issue protocols on each and every subject, which helped us on ground to take forward the work with mission. Once we got ready, we had made the arrangement for the patient. At least in Chandigarh, we did not have a problem of resources. We made 1,500 beds available at CCC for just simple understanding. This is the beds which do not require oxygen, and the things were put in place. Thereafter, the second is the hospital with oxygen, which was 3216. They made arrangement with the beds, around 500 beds were made arrangement. And third is the tertiary level, where we can have ventilators. So at present, we are in a position to take the load, and our all centers are in place, and testing has started. In initial also, the testing was little difficult because the resources and the infrastructure was not in place. Now we have a testing facility at PGI Sector 32 IMTAC in Chandigarh, and with the present scenario of antigen testing, we have taken up the testing to around 600 to 700 per day. So this makes us little more easier. Then we have arranged this testing facility, sampling facility at four places within the health department, that is sector 16, 22, 45, Manimajra, apart from PGI and sector 32. We have made transit beds in 45, 22, Manimajra, so that the patients which come positive in these respective areas are picked up and taken to the transit beds so that they do not allow to spread the infection. Apart from this, from there they are shifted to CCC or the hospital uh, as per their what we call severity, like they are mild symptomatic, so on. We have also allowed the facility of home isolation. The persons who have adequate space with a washroom, with a helper at home, we have made them easy so that they are in their natural environment at their own place, and their recovery becomes little more faster. To carry a step forward, we have made the RRTs, which RRT means rapid response teams. These are ambulances which have doctors and paramedics along with. They are stationed with the facilities. The moment there is any distress call or any old age person, these RRT moves and go at their place. And if medicine is required, they can give the medicine, they can advise them, and so forth. Apart from this, we have made a team of the counselors because this pandemic has brought a different type of atmosphere among the old people. There is a sense of insecurity, there is sense of fear, so they have psychosomatic disorders. So these RRTs teams help us, and these counselors help us to counsel them so that their myths are removed, their reassurance is there, so forth. They are helpful to us even at the CCC centers. Apart from this, we have till today we have done total sample of 23,650. We have 2396 as a positive cases. The cure and discharge are 1351. Number of active cases are 1012, and we had 31 deaths. Here I would like to mention that these deaths are not purely due to COVID. These are an age group on a upper age group, which are with comorbidities, and we cannot attribute directly to the COVID, but definitely the COVID may be having a predisposing factor in their case. Although Chandigarh was the first to start with the effort of putting a home quarantine stickers, which was as a innovation of Chandigarh, and this sticker has been now taken by whole of the country. The moment the IDSP team gets the report of positive, the municipal corporation moves into action and put a sticker team outside the house so that to caution the people around as well as the residents of the same house not to come out as they are positive, and they have to be in quarantine if they want a home isolation. And then we had conducted house to house survey. Again, it was first of its kind. This was based on the pulse polio, where we conduct the pulse polio campaign from house to house. On similar lines, we have made our ANMs with their fortified with the Beldars and experts to move from house to house and to look for ILI and SARI patients. And the moment they came across, because they have a thermoscan, they could, if they could feel that this comes into mild to moderate category or a severe category, they used to call the ambulance, and she was shifted for testing to the nearest facility, and so that we are able to catch hold the contact right from the beginning. So this way we have been very successful. Now, because since COVID has to go a long way, and as per the experts of WHO and ministry, it is likely to take in a year or so. Now the season is approaching very fast. The season has already started with regard to vector-borne disease, which results in dengue, chikungunya, malaria, so forth. So I will like to put across to all my friends that now we have to be more alert along with COVID. These have to be tackled on a war footing because all will present with the same feature. In waterborne diseases, it is always better to have a boiled water for 10 to 15 minutes, 20 minutes, and cool down and use for the day. If because even the potable water which we receive can be of impurity somewhere, so we should be on a safer side. And for controlling the chikungunya and the dengue, although the my administration and my department is moving, but if each one of us join in putting the oil on the surface of the water in and around our houses, this will lead to control of the vector, this will lead to control of the larva formation, and we will save ourselves and our neighbors. Because the fly of this mosquito fly is up to 100 meters all around. And again, each children of the school should be educated, NGOs, resident welfare associations, that they should make sure that there is no water stagging or logging in or around their house or the rooftop or in their own house. Like we have a flower pots, we have a refrigerator where underneath where we have a tray of water. These are breeding places. So this way we will be able to not only control the COVID, we will also be able to control our vector-borne diseases along with. So,
Sir, may I, sir, interrupt? I will return to you again, sir. We are asking in the beginning each speaker to give their initial comments. So, excellent inputs and great initiatives in the Chandigarh UT, which is happening. Let me bring in the industry perspective here, and let me request Naresh Hasija from Mylan to talk about what is the role of your organization, how UHA industry are contributing in this situation. Naresh.
Thanks, Ravi, and I welcome all the dignitaries in this panel. So, we being a pharmaceutical company, we also were like on the task of providing access of treatment in this most important time. So, there was a lot of news: drugs will be in shortage, and because factories will be shut, API import is getting affected because whole world was on lockdown. So I think I will say that Mylan as a pharmaceutical company managed it very well. So we starting from our raw material team, regulatory team, manufacturing team, and of course then the team of supply chain which takes it to the market really worked very well, and there was no shortage of any essential medicine which we manufacture in India for our portfolio here. And the most exciting thing which our team did in a very short span of time is they came up with the COVID treatment. So, which probably I'll be talking in my next discussion. And very interesting to see all the folks working together here and coming up with a fantastic solution.
Sure. Naresh, excellent inputs from your side, and let me reach out to if Dr. Ratan is still here. I do like I heard that he had some meetings. Okay, he's like still to arrive there. So let me reach out to Dr. Lal, who is the director of health from Mizoram. How like your experience of handling COVID situations and of course arranging for the medicines and the kits, if you can talk about it. Ratanji, welcome. In fact, I was trying to like reach out to you. So, yeah, I think let me request Dr. Ratan to speak up first. I think he has some meetings and he has to leave. So let me request him to speak. Ratanji, welcome.
Yes, sir.
Just asking you about requesting all the speakers to keep your mic on mute so that we avoid the background noise. Yeah. So Ratanji, asking you about that. How has been the COVID situation in Kerala and how has the government, uh, the steps taken by the government to control the situation. If you can talk about that.
So Ravi, the pandemic, as everybody is aware, are at various stages in various states. So as per the experts, we've been seeing a lot of spike happening at various places, and Kerala is also in the phase where we are getting more cases being reported from across the state. So our strategy has been, I mean, from the beginning, it has been one wherein we believe the people and also ensure that they follow some protocols which has been laid down by the government. So from the beginning, our strategy has always been to do active surveillance, passive surveillance, and contact tracing, so that we'll be able to identify the index case, and we then move ahead with the primary, secondary contacts and try and see if we can break the chain. So that has been our strategy from the beginning. And once we test and we identify an index case, we quarantine them. Now we are following all the COVID protocols. Once if a person is positive, it can either be a person if is not very serious. Now we are also allowing a person to be at home, or managing cases in what we call the first line treatment centers. So our main agenda now is to ensure that people uh, don't have they don't spread the disease beyond a point, so that we break the chain. That is the main area. So when we identify a cluster, we ensure that we have this cluster containment zones. I mean, all the states are also following the same. But where we need to focus now is also on controlling mortality. So cases are there, but we need to ring fence the elderly and vulnerable group of people who are at risk. So we have various campaigns which we have undertaken to ring fence the elderly and also assess them, especially the people with comorbidities. So we have identified all the people across the state who are elderly. We have the list. We reach out to them and ensure that the reverse quarantine are strictly followed. And people with comorbidities, we ensure that the requirement of drugs and all that reaches to them at their home, so that they don't venture out and move around, which will be risky for them as well as for others at their homes. So one important thing which probably every state is now doing is to see how best we can treat the patients who have been diagnosed. One is there are a lot of asymptomatic people who are best treated at their homes if they have all the facilities for maintaining quarantine, or
their home if they have all the facilities for maintaining
center.
quarantine, or
So that is the first one which I think everybody is trying to do. But what we have done also is to create one more level of CFLTC, which is not a hospital setup, but in between asymptomatic case where it's getting treated in a CFLTC, and what we call a mid-level CFLTC, which will treat to what we call the category B patients who are having a bit of comorbidities. So these people are also getting treated right now in all the hospitals. So if you look at the surge and follow the epidemic in your particular state, what happens is the serious cases will start landing up, and then you'll run out of beds. So what has to happen is a proper management of a case. If asymptomatic, you need to see where they can put them, and management of people with the lesser, not very severe, but lesser severe, you can manage them at the next level of facility center. Need not be a hospital. Hospitals, you can always maintain it for what we call a category C patient who will be very serious cases. So we are trying to achieve that, and we've been quite successful in doing it, as well as managing all the cases. So our hospital beds are still vacant. We are our CFLTCs, we've identified enough. Even that is around 45% occupied at this point of time. We've brought in the next level now, so that we will treat some severe cases, not so severe, who will need hospitalization. So one activity which we've also very consciously done is to involve the private sector in management of not only the CFLTCs but the MMUs. They also come forward with giving their HR also assist us in maintaining the ventilators and ICU sufficient numbers. And thanks to Ayushman Bharat, we've been able to negotiate a good rate for with the private hospitals, so that they are also available with us. So these are various things which we've been doing, and also ultimately the most important thing, in spite of doing all of this, is adherence to protocols by the people themselves. So that is a very, very important and critical activity which is supposed to be done. So what we are doing is, we've had multiple rounds of campaigns. We had what we call the Break the Chain campaign. This we started when COVID was first reported in the country. That happened in Kerala through a Wuhan case. So we started Break the Chain campaign, which was very successful. And we could contain the entire Wuhan spread only to those people who are positive, not even to the family members. Subsequently, we had cases from Italy, US, UK, and all that coming. That also we could easily break the chain. But now, because of multiple reasons, movement across the borders, opening up of various activities and all that, the spread has happened. But yes, we need to encourage people to follow the guidelines. I think that is our motto. Our motto is, our health is our responsibility. We can't keep on pushing rules, regulations from the top, but we need to get that bottom up adherence to these kind of protocols which the government has laid down. So that is what we are emphasizing on now, and hopefully in the days to come, we will be able to get the support of all the people, and we'll be able to bend the curve like we did earlier on before the borders all were opened up. So this is the way in which we are moving forward, and we have absolute convergence of activities of various departments. Though it is health driven activity, there is a great support from all other line departments, which is a very, very critical activity, which very critical activity which is needed at this point of time. A very good convergence of efforts, very good convergence of minds. So that is what is needed in this kind of a scenario. And ultimately, we have to trust in the people, and ultimately you can conquer only by adherence to a few things, basic things. The social distancing, the wearing of mask in public places, as well as ensuring you have regular hand wash and following some etiquettes. I think this is what is needed, and this can all be done provided everybody follows the protocols and guidelines. So that is the bottom line. But rest of all that I mentioned is the paraphernalia which is working towards making it happen. And there has been a very good support from the National Health Mission, from Government of India side, and even the state government has also chipped in. All the departments have chipped in their resources. So it's a fight for a common cause. So everybody have started doing their bits, following the protocols in their wherever they are working. So and this is what we've been doing. Hopefully, very soon we should be able to overcome these challenges that we are facing at this point of time. Thank you, Ravi.
Excellent points of Ratan, and your state has been I think the first point of where this pandemic emerged in India. But I think in the initial stages, the numbers were very, very low, but they have like grown after that. And I think, as you mentioned, that each state is passing through its own cycle, its own peak. So so we will come back to you again in a second, and let's have one input of the industry, and then I will reach out to Dr. Lal. So requesting Dr. Sanjay from Myland to give your perspective on how has your organization contributed in this situation.
Yeah, thanks so much, Ravi, for that. So I think Mylan is a very scientific-driven organization, and we have really conducted a lot of education programs in the whole space of COVID-19. We have a lot of webinars on how to go about managing COVID-19 so that everyone stays up to date. Apart from that, they've also done some really unique initiatives. We had actually provided an education grant to an association called as Omnicurus, and they are an online education partner. So what Omnicurus has done is they have partnered with API, the Association of Physicians of India, to really develop a very robust education module on how to go about managing COVID-19. So it starts from the real basics. It also discusses the whole aspect of controversies, the various concepts, how to manage COVID according to the various guidelines, the algorithm of how to triage patients based on the in resource limited settings, and also certain preventive strategies. So this course is unique in the fact that it also is CME accredited. So you can get credit hours at the end of, finishing these various modules. You'll get a certificate as well as credit hours, which the doctor go on to their respective medical council and work with. So we're also looking at ways how we can get this education module to the state healthcare department, so that at the end of the day, this robust module is already available, and we would like the healthcare departments to benefit from this as well.
Sure. Uh, Great point about creating awareness and training, Dr. Sanjay. Thanks for that. May I request Dr. Lal, who's a director of health from Mizoram, to give an idea that how your state has handled this situation of COVID-19.
Once again, ours is a very small state with a population of 13 lakhs only. So since the government is taking every steps to contain this, we are faring very well until the Sharmistra train and the borders are open up. Now the main problem with the state is that paramilitary forces are moving in, and almost 90% of them are testing positive in the quarantine centers. And the borders, once it's open up, we have truckers coming in carrying essential commodities, and they are being tested in the borders with antigen testing, and many of them are coming positive. This is a main issue. Otherwise, the people in the state itself, taking care in wearing masks, and maintaining social distancings and doing hand washing. The government is very strict, when it comes to wearing masks and spitting in the public and not maintaining social distancing. They're being fined. We have ununiformed squads roaming around in the streets, and catching those people not wearing masks. So at least in the capital, this this system is working very well, because we have the maximum cases in the capital, and we have a very good participation from the local communities and NGOs, and they are being involved and they implementing the government's directives. So in maintaining the social distancing and all those community meetings have been curtailed, and they were keeping an eye on all these activities. The local task force people, they're doing a great job, and we have a good participation from Indian Medical Association Mizoram branch, who help in visiting the quarantine centers free of cost on voluntary basis. They go in teams and see what's happening in the quarantine centers. Although the government is doing everything, but the government cannot do each and everything. So we have good participation from the retirees, retired persons, and we also have good participations from the university side, who are doing visiting all over the states, and who are having what do you call online counseling to distress people due to this COVID-19. And we also are very grateful to the government of India for providing a lot of PPE and reagents which are required. As we know, Mizoram is very cut off from the mainland, so getting all this VTM and PPE, everything is very difficult unless when the borders are closed and the flights are cancelled. So we are really grateful to the government of India. And again, as I said earlier, there's a good participation from the community, contributing for PPE, stitching up PPE and contributing for the uh, mask, stitching of masks for the police forces. So this helps a lot in containing all these issues. Also, we have a good participation from the police forces in contact tracing. We have a good team of contact tracing in the state level and the district level, and the police are also helping us in contact tracing, so we can easily locate the primary source, secondary source, and all this. So far we've been doing quite well, except for the movement of forces, which we cannot really help, and the truckers who are carrying essential drugs, essential commodities to the state. As far as the government is concerned, the government is doing everything possible for maintaining the triple C and the dedicated COVID hospital, which I'm heading right now. And we are having good protocol SOP for each and every branches of the triple C and the community levels and the dedicated COVID hospital also. And we have a separate protocol for Group D nurses and the doctors and the drivers also, so that we do not spread the disease. So far, we have had only 7 frontline workers contracting COVID-19 so far, and they're doing well. Many of them are asymptomatic, so those who are symptomatic also have recovered. Thank you.
Yeah. Great to see that your state is less affected by this situation till now. So let's hope that things improve fast. And let me reach out to Professor Salman Singh and ask him that how has COVID-19 impacted that running of a government health infrastructure facility, that you are running a medical college and you also are running a hospital in your institution. Though, so how is COVID-19 changing the way the hospitals are run, and what are the short-term and long-term impact which you are seeing of this? Please unmute, sir. Yeah.
Yeah, so very, very pertinent question. I think we know that everybody is appreciative, and we all know that government is extending the full support, but we also realize that we were probably not geared up. If you see in March and April, we had a lot of problem. All government agencies or private agencies, whether it is a simple mask to PPE or diagnostic kits, but government did a commendable job, and all Indians they did, as well as globally. And therefore, for the COVID made us understand that if we really want to curtail the huge death rate and the sickness because of COVID, there are three very important aspects of corona epidemic. One is detect, then treat, and of course prevent. I think your theme this time is very good, and adapt and rise, and therefore we have to equip, and we to great extent we have equipped ourselves. The infrastructure is greatly improved, and I'm sure that most of the medical doctors here, they know that Medical Council of India, for the unprecedented decision they took, all medical colleges they will have BSL-2. Now, no medical college without BSL-2 in the Department of Microbiology will be recognized. So this is unprecedented. The government of India made so many task forces, included most of the INIs, that includes PGI Chandigarh, JIPMER, and all AIMS. And therefore, the evaluation of various diagnostic kits, evaluation of various PPEs, modules, trainings, webinars, Center for Excellence, hand-holding, mentoring, certification of various laboratories. So this was unprecedented. And in that series, I would say that the Ministry of Health plus DHR and AIMS Delhi, we decided to develop a network, and all states, they were given the responsibility of the mentoring the diagnostics. This was done in the first week of April. It was realized that diagnostics we were lacking hugely. And I'm sure that everybody knows that in the beginning that every political party and internationally, nationally, everybody was crying that we are not having tests, and therefore we are missing. And then within few months, rather I would say few weeks, 6 to 8 weeks, within 2 months, the India developed its own diagnostic kits, imported most of the real-time PCR systems, including the automated RNA PCR systems and the diagnostic kits. Earlier we were not having. Now we are having more than 1,200 laboratories in the country which can do RT-PCR. Added on these 1,200 RT-PCR labs, we have about more than 2,000 the labs which are doing either TrueNet, which is indigenous product, and the CBNet. These both CBNet and TrueNet, they were being used for tuberculosis control and diagnostics. Now, Government of India, again, another unprecedented thing, because all diversion from the TB. Of course, one can argue that because of this, the TB is being ignored or the diagnosis is not being made. But yes, right now it has become, the COVID has become priority. So obviously these all resources, including the technicians, the CBNet, TrueNet, they have been put in. So almost we can say that about 3,000 laboratories, they are doing corona diagnostics. Now, on top of that, now we have the antigen, for which obviously you don't require BSL-2, you don't require any specific infrastructure. Of course, we have to collect the sample and bring the PPE kit and all these things. But now we also have the antibody test. One caution about the antibody test, because some of you, I am sure, that must be knowing that Government of India, because this was under tremendous pressure in the April month, because test, everybody said test. And that time, what happened, that many of the kits, they were imported in hurry, and Korea and China, they prepared many of the rapid tests. And then India realized that, of course, they were imported rather in hurry. They were not even evaluated, and then really we found that in the first week of corona infection, its sensitivity is less than 30%. Even after 2 weeks of the symptoms, the sensitivity doesn't go more than 50%. And its significance at all is only for the serosurveillance. And then, of course, it took about 6 weeks or so to realize and to retract and to issue the advisory. So the ICMR has done really tremendous thing. 3 organizations, I can say: Ministry of Health, of course, that is a nodal agency, but ICMR, AIMS Delhi, and the Medical Council of India, these 3 agencies, they have done unprecedented collaboration, and so much of the work over day and night, they have all worked together. Fortunately, AIMS, Medical Council of India, and ICMR all are in the same city, so they keep on sitting every week. They keep on revising the modules, the protocols, whether it is a protocol for testing using the antigen or RT-PCR, TrueNet, or the CBNet, or it is antibody testing or not testing. So all these guidelines they have been doing every week. They are updating on their website. So this was something unprecedented, and of course, because that is the reason that we are doing almost several lakhs of the tests every day, which was kind of, you can say, it was just a dream. In April, when the first week of April or last week of the March, when we were just on the verge of the epidemic. The another thing that several ministries, they came into existence in the existence, and which were actually like Ministry of Textile and other ministries. They came up because we were not having proper PPE, the mask, and all these things. So all these ministries, the government has done really wonderful, and because of that, we have right now good infrastructure. Earlier, coming to the, from the diagnostics to treatment, earlier we know that, there was no medicine, and then slowly, various medicines, they were repurposed, I would say. And then whole story, I will not go into detail, SCQ is good or bad, but definitely for prophylaxis, ICMR was very clear from very beginning, even though WHO was not appreciating. But ICMR from day one, it was very clear that for prophylaxis we will give. Even though data is coming up, we were also involved in many of the clinical trials. So, and then of course, remdesivir came, and then, IL-6 antibodies, tocilizumab, what we call, they also came into picture. And then these drugs, along with the, corticosteroids, they have made significant difference. Of course, I must caution here that in a private setup and some of the setup where the protocols are not properly used, these medicines, including the steroids or tocilizumab or the remdesivir, they are being overused or misused also. This is also very important that, if those who are not seeing the protocols in ICMR and clinical center for excellence, which is again the ICMR and AIMS, they probably need to join this network. And here also it is very clear that in many of the cases it has been seen that even though there is not a cytokine storm, but the IL-6 antibody they are given. And then what happens that many of the Bombay studies and the experience from Bombay, we keep on listening every week, that what happens that storm is down, so patient is little better, and then these patients, they mostly they die of the secondary infections. So that is very judicious, and a specific protocol has to be followed, that when you need to give TCL and when you should not give, or you can manage by the steroids or oxygen. So oxygen becomes very critical. But again, what is still I have personally, in my capacity as a director and mentor of the whole state of Madhya Pradesh, I have written that another issue, I think you can add this aspect in your magazine also. The most of the hospitals, we are facing the difficulty in oxygen, LMO, what we call liquid medical oxygen. That unfortunately that is governed by NPPA, but there are only 2 or 3 manufacturers in the entire country. And what is happening that they are doing monopoly. So they are, say for example, in Madhya Pradesh and Chhattisgarh, only one bidder is there. So he will be the person and he can charge anything. Even though, as I said, NPPA has some regulations, but he will charge on this pretext or that pretext. So basic price, they will follow the NPPA guideline, but then they will add this thing. So I think that infrastructure part I have written already to Secretary Health, that this aspect is still, I think, is required. But otherwise, the medicines, clinical trials, we are doing vaccine is also maybe few months behind, but we are also on the same track. Maybe if other vaccines come in December, we might bring our own vaccine by March. So it will be a difference of 2-3 months, not more than that. The treatment, all medicines, obviously we have remdesivir in Maharashtra, there is a issue, but sometimes it is a issue in private institutes. We also face, because we being the government organization, we purchased, and then many of the private hospitals, they come to us, and then by virtue of the regulation, we cannot issue them. So sometimes the secretary or the collector or directors, they request us, but that is also undue pressure, because probably limited stock is there, so supply is not supplying to private agency, because production is, I think, need to be upscaled. So that is probably one limitation, and I am sure that by this month end or something like that, this will be sufficiently available. So it need not to be issued only to government hospital, maybe for private hospital also. And the third aspect, I think, prevention. Everybody has talked. I would not go into more details. So prevention, hand hygiene, the distance, and of course the mass masking, I am saying. So these 3 aspects are equally very important. In summary, I can say that we have done great job in the last 3 months. but still miles to go ahead. Thank you.
Sure. Excellent points given in detail, Professor Salman Singh, and thank you. And I had seen our speaker from Uttar Pradesh, Hira Lalji, joining. Ichi in the backstage, if you can come on the stage, if he is still there. Okay. By the time he comes in, let me ask Mylan speakers that what are your views about access to medicines at the critical time? I think this COVID-19 situation is a critical situation, and various districts or states needs timely supply of medicines and other things needed to handle the situation. So, any inputs you want to give as a industry perspective?
Yeah, thanks, Ravi. First of all, it is really pleasure to listening such a diverse group, like starting from Dr. Devan, top in Chandigarh, coming to Kerala, Dr. Sarman in Bhopal, and ma'am in Mizoram. I think really pride and very different perspective. Dr. Devan and Dr. Kelkar, as they talked about the bottoms approach, saving yourself. I think this is unprecedented in India, and the way Kerala has contained by contact tracing, breaking the link. Dr. Kelkar explained it so well. I think it's pride to be part of such a panel, which is like very diverse. Coming to our availability of providing critical medicines. So I think Mylan has been extremely vigilant in this space, and we are known for our access across the world. And we supply our medicines to 165 countries, and majority of it is produced pride in India itself. And we have a huge number of manufacturing facilities in India. So the most important thing for us is protecting our employees, because these are the employees who are going to produce these medicines. So when we are talking about it, protecting our employees means bringing discipline among them. So as Dr. Kelkar was explaining to us how they were breaking the link, how they were breaking the chain, I think our teams here in internally in our all factories, all our allied departments, they followed it so well. I will say that I think we could save our people. Ultimately, who has to produce medicines, who has to work in factories, and to serve these 165 countries. The good thing was India was made a top priority in this time, because we belong to this country. We said that most of our manufacturing facilities are in India. Let's make sure none of our essential medicine which we are supplying to government should be in short supplies. And momentum of this, you can see that I think as Dr. Salman was explaining about shortage of remdesivir and other things, with Mylan's entry, so we chose a path of supplying our remdesivir to state governments directly. Right now, I can say this with full pride: 15 state governments in India are purchasing Mylan's remdesivir, and we have rate contracts with them and already in place. Whatever demand they have, we are able to fill it. We have huge manufacturing facility which can produce, I will say that maybe 500,000 vial a month, which is a huge quantity, and we can scale it up any moment. So we are ready for any kind of situation here in India. And to answer your question, Ravi, essential medicines, we will make sure from our side it is not in short supply at all.
Sure. So let me request each of the speakers to give their closing remarks. I think we are almost at the end of the session. So requesting Dr. Devan, if you can give your closing remarks on how you are seeing the situation, the impact on the health infrastructure and doctors, what are the challenges, and how will it be addressed. So just
on.
closing remarks.
Well, I will close with the word that it's a long distance to be traveled. The mantra for the safety of each one of us that we have to maintain distancing. We need to wear mask, not for a cosmetic reason, but for the reason to protection. Sanitizer, if not sanitizer, then soap and water is the best medium. And here I will like to request the industry, they should come out with the masks which is affordable, and the IEC has to be carried out among the beneficiaries which are our low socio-economic status. The fear which was initially in their mind is slowly and gradually going out. We have to infuse the fear why this has to be done in continuity, and all NGOs, governments who can sustain it should give free of cost the masks. If not, of the cloth can be used in their houses, at least 2 to 3 sets, so that they can wash and reuse them, because the poor man is very difficult to afford 10 rupees, 5 to 10 rupees daily. And these are the people who are visiting our houses for their daily work. These are the people who are asymptomatic and symptomatic and are the carriers. So let us all work together, government as well as the private sector, along with the economical availability, so that we are able to save the country in coming days from increase in number of cases, and we can break the chain of infection. Thank you.
Excellent points. You have gone to the basics, Dr. Day1. They are the very important things. Can we have Dr. Ratan on camera if he's still here? Dr. Ratan? I can see him. So let me move to Dr. Lal on your closing remarks on combating COVID-19, your state's strategy.
Well, as we had just heard, I think masks should be freely available to the public, especially to the lower strata, either free of cost or it should be at an affordable price. And I think the visitors house should come forward in providing masks to everyone, to every household, free of cost. And availability of hand sanitizer should be, ensured in all the states and in all the cities and at every household if possible, because we cannot help in sitting at the home all the time. We need to go out and purchase things like that. We keep handling currency notes, which are a good medium for transmission of COVID. And the importance of hand washing should be promoted. This is not just for this during the COVID pandemic, as this has been practiced in the Southeast Asian countries. Hand washings and wearing masks should be promoted to every household and everybody in the country, so that India will become a very healthy country. Thank you.
Dr. Sanjay, I want to ask you about your closing remarks from an industry perspective.
Thanks so much, Ravi. Yeah, I think this was a really great session. And I think Mylan, as a company, I think we're going to do whatever it takes, whether it's in terms of education or Naresh rightly said, whether it's in terms of access to medicine, to really help all the whole healthcare professionals out there in the fight against this deadly pandemic. And I think all of us are really going to come out stronger at the end of it.
Thank you, Dr. Sanjay. And Professor Sarman Singh, sir, your closing remarks.
I would say that, I always say that, Madhya Pradesh state is doing quite well, and there are some other states also, but I always say that you cannot afford to be complacent. Corona is not going away. It will take years together. So we have to learn how to live with COVID, and for that, the other speakers, what they said, we have to equip We have to develop our drugs, our vaccines, but most important is that crowd, which is not still, they are not able to control. So I see what Dr. said. The information and the awareness, I think, requires more and more. Even our political crowds, they are not, so it is not starting from the top. So that's all. I think the crowd is most problematic, whether it is a sabji mandi or it is a political crowd or railway station. So crowd is, still going to be a problem for everybody.
Really
Yeah.
well.
Thank you.
Excellent point, Professor Singh, and we have Dr. Ratan here. So, Dr. Ratan, asking your closing remarks on, especially about the access to medicine at these critical times of the COVID-19. Your state's strategy and roadmap for the future.
I think what we have done is ensuring that there is universal access to healthcare in terms of public facilities being opened up. That has always been there, but we've also had a strategic partnership with the private sector, which is also equally important now. See, what happens is in a situation like pandemic, the common person should not feel that the healthcare is out of bounds. But it is only possible if we have a golden handshake with the private sector. So that is possible if we mutually trust each other and arrive at a consensus on the way forward, which we have kind of successfully done in the state of Kerala. So we've had a partnership going with the private sector so that they give us not only the HR but also run our CFLTCs wherever it is needed. They also provide us ICU beds and ventilator support at various places where there is a requirement, and they also take the non-COVID load. So we are talking mainly about COVID. There's a huge sector of non-COVID, which is also which also has to be taken care of. So a strategic division of COVID and non-COVID, identifying hospitals which can be converted into COVID, which can be converted for non-COVID. All that will happen if everything gets pulled up as one resource. Then you look at managing all your resources as one. So that is the way forward. And another important thing which we have done is people with comorbidities and non-communicable diseases, especially diabetes, hypertension. We ensure that the medicines reach their home. At least we give them a stock of a month through our ASHA workers, and what we have the local level, ward level committees. So using them, we ensure that they are all taken care of, so that their health needs are at their doorsteps. And of course, we have the IT platform. We have various eSanjeevani platform, or all those platforms are there, which we can always use to get connected and ensure that healthcare is at the doorsteps. And of course, see, the entire thing is more of a logistic management when it comes to managing the facilities. So you have an ambulance call center, you have people in the ground, your foot soldiers who are managing the entire thing. So if you have a well-oiled mechanism, all of these things will fall in place and everybody will be able to give the desired result. And in all of this, we all need to work as one. That is, there's no second thoughts about it. Everybody should put in their resource, be it the private sector, be it the public sector. We all need to work as one. Only then we'll be able to manage things better, and healthcare will not be out of reach of the common person. So that is what we should all work towards. And I think it's not a very difficult thing to do, but we just need to put our heads and minds together and work as one. I think it is all possible.
Yes. Great point about working as a team, working as one. Thanks for that, Dr. Ratan. And we have with us Mr. Hira Lal from UP Health Department, the Uttar Pradesh Health Department. So, Hiraji, if you can talk about that, what are the strategies for access to the medicine in these critical situations, based on your experience in UP? Am I audible, हीरा जी? आवाज आ रही है आपको? You are on mute, हीरा जी. आप mute पर है.
सर म्यूट पे
हीरा जी आप mute पर है. Please unmute. हाँ जी,
Hello.
हाँ जी. आप
I'm
हाँ जी,
audible?
हाँ जी.
Okay.
Yes, yes, yes.
Actually, there is some net problem where I am sitting. So I joined 3-4 times, but I could not connect properly and disconnected. Anyway, so in UP, the management seeing the overall condition is satisfactory. And as I said in my earlier webinars also, the way we have tackled the COVID in India is satisfactory seeing our conditions. There is no doubt about it. The COVID is not developed in our country. It is a international phenomena, and the developed country are in more hardships as compared to India. So if we compare ourselves from the developed country, we find ourselves in a better position. And initially there was some problems, but in 6 months, right, by now it is about 6 months for the COVID. So by now everything is settled. In the beginning, when the number was small, there was good panic, but now when number is more, panic is less. It is because of settling the things with the time. I am not a doctor, I am an administrator, I am a doctor of managing the things. Right now, the problem before us in the last 6 months, we do have spent our physical health, health, mental health, and economical health. By now, we all have exhausted in the last 6 months. In coming 6 months, as we are getting news from different sources, and as we expect that in coming 6 months we are not going to get the killer medicine of the coronavirus. So from now and onwards, in coming 6 months, our strategy should be changed. We should not only focus on COVID. Along with the COVID, there are many other illnesses which are not taken care of properly because our total energy is focused towards the COVID. So we are saving life on the COVID side, on the COVID front, but on the other front, from the other illness, we are getting casualties. So strategy from the medical health perspective should be changed because of economic stress which is increasing at a very fast rate. There is a program, mental health program by the government of India. So we must activate that team. In every district there is a team to supervise, to see, to provide the counseling and everything for for mental illness. So our strategies should be changed in new situations so that we can manage the exhausted economical, physical, and mental things. So that is this I am speaking at different forums to point out so that we can change our strategy. Regarding the medicines, whole world, and what I say, in a big building, only the most important room is the research and development room, where people are researching, people are trying to find out the solution or medicine for the coronavirus. So one thing we must learn, that research and development, which is less in India, the expenditure on this must increase, and it is a learning from this epidemic. So this is the whole scenario in UP, and my focus is right now in my talk that we must change our health management strategy. But in general, in many webinars I have heard, still we are talking about the COVID, its management, and we are not envisioning what is going to happen in next 6 months. So this is my point which I wanted to bring into the focus of all the panelists. I request you all, please think the strategy to change our old strategy which worked well in the last 6 months and gave good results is not going to work and is not going to give good results in coming 6 months in the light of exhausted situation of each and every person mentally, physically, and economically. That's all I wish to say. Thank you. I may go out because of my net is not working properly. I tried to
Yeah,
connect 4 times, I got out.
we are concluding the session,
concluding the session,
Hiraji.
Hiraji.
So
Yeah.
So
don't worry about it.
worry about it. Yeah.
So last
Last remarks
from industry.
industry.
So thanks, Ravi. I think after listening to remarks from seniors like Ratanji, Galalji, and
Galanji and
what it was from Professor
Professor
Sarvan, where he said that TV is getting ignored.
TV is getting ignored.
So we have some echo coming.
It's a like eco is happening.
Yeah, maybe there are two mics at one place. Okay. So I heard TB is getting ignored. No doubt about it. Our core role is to provide access of remdesivir at right now for COVID across India, which we are doing. 15 states have already accepted it. Now, after listening to all this, I will add in my closing remarks. I think tuberculosis, viral hepatitis, HIV is also going to be our top priority, where we already provide access to central government for all our medicines. So we assure from through this platform, we will be continue to provide the best access of all these diseases which I just spoke about: TB, HIV, viral hepatitis, and COVID treatment for the masses. Thank you.
So I wish to thank all our speakers, Dr. Ratan Kelkar, Dr. Day1, Dr. Sanjay, and Dr. Lal for joining us, and of course Dr. Sarman Singh and Dr. Hira Lal, who joined from across various states. Thank you so much for such an enlightening session, and we had so much diverse experiences from diverse states, which was an eye opener in many senses. So with this, saying thank you and namaste to everyone. Namaste. Thank you, and see all the audience. See this for our session. Namaskar, Ratan. Thank you for joining. Thank you, Naresh.
Thank you.
Thank you, Ravi. Good wishes.
Thank you. Thank you. Thank you, Dr. Lal. Namaskar.